Friends, for a change, now I would like to talk to you on a very general subject, a general medical subject, or you can also call it as a medical disorder, namely the blood pressure, the high BP and the low BP. See, BP or the blood pressure, it is the pressure exerted on the blood flowing in the blood vessels on account of the contraction and the relaxation or the expansion of the heart. So, the pressure exerted on the blood flowing through the blood vessels due to the contraction of the heart, it is called as the systolic pressure, and it will be generally, it varies between 100 and 140 millimeters on the mercury scale, and that pressure exerted due to the relaxation of the heart. So, that is called as the diastolic pressure, which varies from 60 to 90 mm. So BP is required even for normal circulation of blood to all parts of the body. There is also a controlling system in the body, inbuilt system to adjust this pressure constantly when we are sitting or standing or walking. So BP does not vary too much under different circumstances because of this controlling system in the body. So the normal BP is it ranges from 100 by 60 to 140 by 90. And as age increases, the BP also increases. And even in the healthy normal individuals, it's not a constant figure. It varies under different circumstances. So the exercise, the exposure to cold, mental stress, emotional upsets, all these temporarily increase the BP. So when you are in relaxing or the resting mode, it's on the lower side. In an adult, if BP is greater than 140 by 90, in the relaxing mode, he is considered to have high BP. However, the condition of measuring instrument, the emotional status of the patient, the environment, all these have to, have the effect on BP. So therefore, repeated examination in a fully relaxed and calm atmosphere is required to decide whether one has a BP or not. So the high BP, it is called as the hypertension, and low BP is called as the hypotension. The expansion and the contraction of the arteries, which are felt at the wrist, it ranges between 65 and 80, average is 72. So the pulse pressure, this is called as the pulse pressure, and this pulse pressure is the difference between the systolic and the diastolic pressure. So the symptoms of high BP are the giddiness, severe headache, irritating temper, lack of concentration, the dimness of vision, breathlessness, swelling on ankles, worry, short temper, the emotion, etc., etc. And at the same time, there could be no symptoms also. So if this is not controlled, slowly it may lead to chest pain, heart attack, paralytic stroke, the damage of eyes, the damage of blood vessels, damage of kidneys, etc., etc. So the hypertension, that is high BP, is very common. The real cause is really not known. Certain hormone changes in the kidneys may be partially responsible. So the nervous tension also plays an important part, and a certain tumor, may also, rise BP, but this is very rare. So in 10% of the cases, the infection of the kidneys is also sometimes responsible, and we only know what is taking place, but not the actual reasons for that. So it is still a mystery. And doctors call this essential hypertension, a simple admission that we do not know. So usually the process is very slow, but in some cases it comes on. I mean, much more rapidly, and it is known as the malignant hypertension. So BP not only it affects the heart, kidneys, and brain, but also eyes because of the retinal hemorrhage. And the most BP patients, they have family background of strokes, heart diseases, and kidney ailments. And ordinarily, the stress and the strain of leaving, the nervous stimulation, etc. So this may also cause the changes in the arteries leading to BP due to the changes involving kidneys. And the nervous factors also, they play a large part. So any kind of excitement will cause the heart to, pump more vigorously, or we say pounding. So this pounding or palpitation, it may also lead to the increase in BP. Of course, I'm not a doctor, I'm not a medical professional, and whatever I'm repeating here is all that we have studied in our science subjects at the school and college level. The normal BP is 120 by 80, but it may go up to 140 by 90 and still be normal. So anything above this leads to hypertension, especially if the BP goes up to 180 or 120. It really, causes some unusual things. So the upper figure is, what is there in the numerator. So that is the systolic pressure, and that in the denominator, that's the lower figure, it represents the diastolic pressure. So the lower figure should be maintained within 90. So patients with high BP complain of headache, mainly at the back part of the head and the neck, tiredness and fatigue. So often without obvious cause. Dizziness, palpitation, irritation, and emotional factors. So these are all the symptoms, and the women with high BP are more likely to develop problems during their pregnancy also. So coming to the treatment for the BP or high BP, well balanced food, the exercise, rest, walking, avoiding excessive use of coffee, tea, salt, and the spicy food and the alcohol, even smoking. And the smoking, of course, permanently as tobacco constricts, that is, narrows down these smaller vessels, blood vessels. It raises the BP and increases the workload of the heart. So excessive salt, it increases the pressure as well as the work of the heart. So we have to avoid it. And one must develop a contented mind, a satisfied mind, quite restful attitude to relieve the tension of everyday life. And we have to cultivate the mind to forget the worries. That's the, easy method to avoid the BP. And coming to low BP means hypotension. So low BP or hypotension, it is far less common than the hypertension, and sometimes the BP, it falls due to the hemorrhage or loss of blood also. So it may also come slowly due to bleeding in the gastrointestinal tract or through the kidneys or bladder. The leakage could happen. So lack of normal protein in the diet may also lower the pressure because of the malnutrition, starvation, or due to the endocrine disturbance like hypothyroidism. So due to the islet cell tumor in the pancreas producing excess amount of insulin and lowering the blood sugar, it may also cause this low BP and the emotional problems too. So low BP or hypertension, it is, as I said, it is less common, and the excess amount of insulin, what I said, produced in the pancreas, it may also cause, lowering blood sugar and the low BP, emotional problems, the prolonged disappointment and frustration. It may result in low BP. So relieve the chronic stress, develop the sensible attitude of mind, and adding little more protein to the diet, sufficient rest and exercise. So these are the remedies to avoid the low BP.